Case of Bell's palsy. Bell's palsy is idiopathic element type of facial nerve palsy. In this case, we have left side element type of facial nerve palsy in this patient. So we will examine the patient in a stepwise manner. Now I will ask the patient to raise his eyebrows. So here we can see the wrinkles on the right side, but the wrinkles are absent on the left side. Now I will demonstrate the Bell's phenomenon in this patient. I will ask the patient to close both his eyes and let us see what will happen. Here we can see when the patient tries to close his eyes, there is uprolling of the eyeball on the left side. So here we can observe the uprolling of the eyeball on the left side. This is Bell's phenomenon. And here we can see the loss of nasolabial fold. Here we can see prominent nasolabial fold. Here we can see the absence of nasolabial fold. Okay. Then I will ask the patient to clench his teeth. On clenching the teeth, the mouth will be, angle of mouth will be deviated to the right side. Because the mouth will be deviated to right side because the muscles on the left side are paralyzed. So there is predominant motor action of the right-sided muscles. So the angle of mouth on the right side will be dragged towards the healthy side. Ian. So here we can see the deviation of the angle of the mouth, the right side of the mouth to the right side, that is towards the normal side due to weakness of the left-sided muscles. So first we saw the absence of wrinkles on the left side with Bell's phenomenon on the left side, loss of nasolabial fold with contralateral deviation of the angle of mouth. This is Bell's palsy, which is idiopathic element type of facial nerve palsy. The facial nerve palsy should be diagnosed, the Bell's palsy should be diagnosed after exclusion of all the possible diagnoses. The treatment for this patient includes, the main treatment is steroids. Steroid plays a major role in treating the Bell's palsy. We start 60 to 80 mg of prednisolone for this patient for 5 days. Then following 5 days, we taper for every 5 days. Taper by 10 mg for every 5 days. Then facial physiotherapy is indicated in this patient. The role of acyclovir or valganciclovir antivirals are absurd according to the Harrison 21st edition. There is no major role for antivirals. If there are vesicles in the external artery meatus or tympanic membrane, which is suggestive of herpes zoster infection, then we can start antivirals like acyclovir or valganciclovir for this patient. The role of antivirals is because many times we see we isolate herpes virus from the endoneural fluid of the facial nerve. So there is hypothesis that the herpes zoster or reactivation of the herpes virus from the geniculate ganglion is responsible for the facial nerve inflammation in the fallopian canal, that is facial nerve canal in the middle ear, resulting in compression over the facial nerve, causing Bell's palsy. So when there are vesicles, evidence of herpes virus infection, then we can start the antivirals along with the steroids and facial physiotherapy. So majorly facial physiotherapy and the steroid plays a major role in the treatment of the patient. Actually the full-blown weakness will be by 48 hours. Within 48 hours after the onset of weakness, there will be maximal weakness. Maximal weakness is seen by end of 48 hours. If in the first week of onset, in the first week, if the facial nerve weakness, the paralysis of the face is incomplete, it is a good prognostic sign in case of Bell's palsy. The recovery will be very good. Thank you.